one of my questions is, from a public policy point of view and as an elected official, how the heck do you think we got to this point? I mean, what happened to us?
I don't know. It's interesting that we are here because it is an expensive situation that we find ourselves. One of the things that comes up every year in the legislature involves Medicaid and health care. Just when we think we've got a handle on it, something changes. Something in the system is modified. There's a deficit appropriation that's required. And so it's problematic. I'm not proficient enough in the area to tell you how we got here. I just know we're here. And we've got to be proactive and vigilant in determining how we and what we do to address this issue. It's an issue that is going to require a lot of concentration and a lot of thought, and it is continuous. It's ever changing, and so I don't know how we got here, but we've got to look at where we're going. It's very important. I think that we can all agree that the national health care legislation is complicated and complex, and is subject to interpretation and misunderstanding. Thankfully, the Supreme Court came down, with the opinion that said that no longer will the federal government, at least on this issue, be able to mandate to state governments what you will or won't do by withholding federal funds, which are essentially withholding our own taxes that we've sent to the federal government.
Mm-hmm.
That's very important. For many reasons. One, just because we shouldn't be dictated to on that level by the federal government, and two, there is the real likelihood that had that gone into effect the way it had, we couldn't have afforded it with the funds that we have now, and so that would have caused us to look at, in effect, finding, even if you look at the moderate participation scenario, $1,267,000,000 that we don't have. I know there's the argument that it's made in savings. That's an argument I've heard for years.
That's a scary argument.
It's an argument that I'm not willing to just accept at face value and say, well, oh yes, because we're going to offer yet more free services to people, they're going to be responsible in that sense and lose weight, quit smoking, quit eating the things that they're supposed to eat, and because we're going to be providing them more free health care. In fact, I think the converse is true. People tend to take care of themselves less. And so we have to ask ourselves, in the Medicaid environment, what are we doing by providing more people less incentive to provide for themselves? And I think it's more disincentive for people to be independent. It's more disincentive for people to care about their own personal health care and to care about how they're going to provide for that. And so the expansion of the Medicaid program is problematic on a lot of levels, but the idea that the federal government was going to force us to do this was even more problematic and concerning in many ways, on many levels. And they've been doing it for years. Can't tell you how many pieces of legislation were, well, if you don't pass this, now they're going to withhold funds. All the way back to the seatbelt law. If you don't do the seatbelt law, they're going to hold back highway dollars. If you don't do this, if you don't change this, if you don't do that. And thankfully the Supreme Court stepped up on this issue. I think they failed on the individual mandate issue, but on this issue the Supreme Court stepped up. And at least for now we've stopped that issue. And I can tell you, as one legislator, the monies with strings attached, or sticks attached, however you want to say it, we're going to resist that at every opportunity.